Hey, everybody, and welcome back for another deep dive with us.
Glad to be here.
Today, we're talking about diabetes.
Yeah.
And, it's something that I think a lot of people...
But a big one.
Yeah, I think a lot of people maybe are interested in, like, maybe they have a doctor's appointment coming up or or a family member who has it.
Exactly.
Or they just are curious about it because it is so... common.
Very common.
And and it's something that, like, we got a podcast interview about this. And it's something that I think a lot of people kind of know the basics of, but maybe don't know, like...
all the details.
Like, did you know that stress can, like, directly impact...
Absolutely.
blood sugar?
Yeah. Yeah. I mean, that's one of the things about diabetes that's so interesting. It's not just one thing. It's kind of a whole spectrum of different things going on.
So let's dive into that.
All right. So first of all, like, what is it? Can you explain it?
In the simplest terms.
Yeah, like in the simplest terms for someone who...
Yeah, so at its core, diabetes is a condition where your body has trouble regulating your blood sugar, also known as glucose. And that's where insulin comes in.
Okay, yeah, I hear about insulin all the time, but I'm not really sure, like, what it
does. Yeah. So insulin's kind of like a key. It unlocks your cells so that glucose can get in from your bloodstream and be used for energy. So when insulin isn't working right, or there's just not enough of it, that glucose, it builds up in the blood instead of getting into the cells, and that's where the problems start.
So it's like a key that either doesn't fit the lock or you don't have enough.
Exactly. That's a perfect way to put it. And that kind of leads into the different types of diabetes. So we've got type 1 diabetes, where your body's immune system actually attacks those cells in your pancreas that make insulin. So it's like your key factor gets shut down.
Okay, so that's type 1. So what about type 2?
Type 2 is a little different. In type 2 diabetes, your body's still producing insulin, but your cells become resistant to it. So it's like those locks have gotten rusty and the key doesn't turn as easily. This resistance can develop over time, and it's often linked to things like lifestyle and genetics.
Yeah, actually, the podcast that you shared mentioned a study about insulin resistance.
Interesting.
And apparently, like, it can even, like, disrupt signaling pathways within the cell.
Yeah.
So it's like making it even harder for...
It really is. Insulin resistance is really complicated, and we're actually still learning a lot about it.
Okay.
Even today.
So that myth that, like, eating sugar causes diabetes?
Yes.
It's not
quite that.
Quite that simple.
Yeah.
It's way more nuanced than that. While it's true that sugary drinks and processed foods, they definitely contribute to weight gain, and that can increase your risk of developing type 2 diabetes, they're not a direct cause.
Okay, so sugar doesn't directly cause it, but it can lead to things.
Exactly. It's kind of a domino effect. Okay. Now, speaking of risk, the podcast that we were talking about also highlighted this trend of rising type 2 diabetes rates in younger people.
Yeah.
Even kids.
It's alarming, isn't it?
Yeah, that's really scary. So what's driving that?
Well, it's multifactorial. I mean, there are a lot of things going on. But I think a lot of it has to do with increasingly sedentary lifestyles, poor dietary choices. You know, we're seeing a rise in childhood obesity.
Yeah.
And that's a major risk factor for type 2 diabetes.
So it's not just our genes.
Right.
It's also
It's the environment, too.
Yeah, our lifestyle.
Absolutely.
Okay. Now, before we get into all that, I do want to go back to the other types of diabetes that
yes.
the podcast mentioned.
Yes. Besides type 1 and type 2.
Yeah, besides 1 and 2.
Exactly.
Yeah.
So there's gestational diabetes. Now, that occurs during pregnancy, and usually it resolves after delivery. It's thought to be triggered by hormonal changes that impact insulin sensitivity. And then we have prediabetes, which is kind of like a warning sign. Blood sugar levels are elevated, but they're not quite high enough to be diagnosed with type 2 diabetes. It's kind of like a yellow light, time to make some changes.
So it's kind of like this...
a spectrum.
Yeah, the spectrum, and you fall somewhere on it, and it depends on...
It really is.
Like, all these factors. Okay, so let's talk about who's at risk. Like, who should be listening to this and be like, oh, like, maybe this could be me?
Right.
Is it just people with a family history, or are there other, like, red flags?
So while genetics definitely play a role, it's not the whole picture. So having a family history of diabetes, especially for type 1, does increase your risk. But lifestyle factors are huge, especially for type 2. Obesity, lack of physical activity, unhealthy diet, all of those things really increase your risk.
So again, it's kind of like...
Nurture.
Yeah. It's like both.
Absolutely.
Okay, and that's probably why it's so hard to, like,
pinpoint exactly.
Yeah.
Like, who's going to get it?
Yeah, like there's no, like,
Right.
if you do these 3 things,
Exactly.
you're guaranteed to get it.
You're absolutely right. And that's why it's really important to understand your own individual risk factors and talk to your doctor about it.
Okay. So let's talk about like prevention and management.
Okay.
What stood out to you about prevention in the podcasts that we listened to?
Well, they talked a lot about lifestyle changes. And, that makes sense given what we just talked about.
Yes.
But there was something that they mentioned that I thought was really interesting. They talked about the Mediterranean diet.
Oh, yeah.
And how that can help with diabetes prevention. I don't know if you've heard about that.
Yeah. I mean, I've heard of it like as a generally healthy diet.
Right.
But I don't know about like specifically for diabetes prevention.
Exactly. So what do you think?
Yeah. So like what is it about it that makes it like good for diabetes prevention?
Yeah.
So the Mediterranean diet, it's like all the rage.
Yeah.
It's fruits and vegetables and whole grains and
good fats, lean protein, all that good stuff.
But like what about it makes it so good for like diabetes?
Yeah. So the thing is, a lot of the foods that are emphasized in the Mediterranean diet, they actually help improve your insulin sensitivity.
Okay.
Which means that your cells are better able to respond to insulin, and that allows glucose to enter more efficiently. And this can really help prevent those spikes in blood sugar that can be so problematic for people with diabetes or those at risk of developing it.
So it's not just like what you're eating, it's how.
If the why.
Yeah. How it
affects your body.
Yeah, how it affects your insulin.
Absolutely.
Okay. Yeah, they actually mentioned a study in the podcast where like people on the Mediterranean diet saw significant improvements in their blood sugar control compared to a standard like Western diet.
And it's not just blood sugar regulation.
Okay.
There are other benefits too. I mean, the Mediterranean diet is also packed with antioxidants and anti-inflammatory compounds. So it can actually help protect against the long-term complications of diabetes, like heart disease and nerve damage.
No, wow. So it's like...
It's a win-win.
Yeah, it's like good all around.
Exactly.
Okay, so good food. Got it. What about like specific superfoods? I feel like there's always buzz about like, eat this berry.
Eat this one food and it'll cure everything.
Yeah. Is there anything that's like...
Yeah. Is there a magic bullet?
Yeah.
Unfortunately not.
Oh, okay.
I wish there were. But there are some foods that are definitely better than others.
Okay, so like what should we be stocking up on?
Fiber.
Okay.
That's a big one. Foods that are high in fiber because they slow down digestion and it can help prevent those rapid spikes in blood sugar. Think fruits, vegetables, whole grains, legumes.
Fiber is good.
Fiber's your friend.
Okay. And what about like protein and fat? I feel like that's always kind of... It's confusing.
Yeah, confusing. Like which types are good, which types are bad.
So with protein, you want to stick to lean sources, things like fish, chicken, beans, lentils. Those are all great.
Well,
and then when it comes to fat, you want healthy, unsaturated fats, things like nuts, avocados, olive oil, and fatty fish.
got it. So lean protein, healthy fats.
Yes.
I'm assuming like sugary drinks and...
Yeah, those are the things you want to avoid. Processed foods.
Yeah, processed foods.
Anything that's going to cause those blood sugar spikes.
Okay, so those are out. Now, we've talked about food. What about exercise?
Exercise is so important.
The podcast also talked about how important exercise is for both like preventing and managing
Absolutely.
diabetes.
Exercise is like your secret weapon
Okay.
in the fight against diabetes because when you are physically active, your muscles are actually using glucose for energy. So that helps to lower your blood sugar levels.
Okay.
And it also improves your insulin sensitivity. So your body becomes more responsive to insulin signals. So you're like giving your cells a workout so they're like better at using.
Exactly. Exactly. And there was a study mentioned in the podcast, right? Even moderate exercise like brisk walking can significantly reduce your risk of developing type 2 diabetes.
Okay.
And for people who already have diabetes, regular exercise is just, it's crucial for managing their blood sugar levels, improving their cardiovascular health, really reducing the risk of all those complications that can come along with diabetes.
So if you're listening to this and you're like, man, this all sounds great, but I've already been diagnosed, like, is there anything you can do? Or is it just kind of like, okay, now I got to manage it for the rest of my life?
That's a great question. And it's something that I think a lot of people wonder about. Can diabetes be reversed?
Yeah.
And the answer is a little bit complicated.
Okay.
In some cases, especially if you have type 2 diabetes and it's diagnosed early, lifestyle changes like losing weight, eating a healthy diet, getting regular exercise can actually lead to remission. It's not a cure, but it means that your blood sugar levels are back within a healthy range without needing medication.
Okay, so you can kind of like...
You can turn back the...
reset things?
In a way, yeah. If you catch it early and make those changes.
So that's good. Now, the podcast also talked about sleep, and I have to admit, I'm very bad at sleeping.
Oh, me too.
Like, I don't get enough sleep. So how does sleep deprivation, like, affect all this?
So sleep is really important for hormone regulation. And when you don't get enough sleep, it throws everything off balance.
Okay.
And one of the key hormones that is affected is cortisol. You might know it as the stress hormone.
Mm-hmm.
And elevated cortisol levels can actually increase your insulin resistance, which makes it harder for your body to regulate your blood sugar.
So it's like this domino effect, like no sleep, cortisol messed up, blood sugar messed up.
Yeah.
Exactly. That's a great way to put it. And it actually goes beyond that.
Mm-hmm.
Poor sleep can disrupt other hormones that are involved in appetite regulation. So you might find yourself craving more food, eating more, potentially gaining weight, which further increases your risk of diabetes.
So sleep is important.
Sleep is super important.
Okay. Got it. Now, going back to what we were talking about, like if you've already been diagnosed with diabetes, I think one of the biggest, scariest things for a lot of people is...
Needles.
Yeah, like insulin shots.
Yeah.
So is that always necessary?
It's a good question. And I understand why people are concerned about that.
Yeah.
But the good news is that insulin therapy isn't always required.
Yeah.
Now, if you have type 1 diabetes, insulin is essential. Because remember, in type 1 diabetes, your body just isn't producing insulin at all.
Because your immune system is attacking it.
Right.
It's attacking those cells. And for some people with advanced type 2 diabetes, they might also need insulin therapy eventually. But many people with type 2 diabetes can manage their condition really effectively through lifestyle changes, oral medications, or other non-insulin therapies.
So it really depends.
It depends on the person, the severity of their condition.
Okay. So let's say you've been diagnosed. Like, what are some of the biggest, challenges people face day to day?
Well, managing diabetes, it takes effort. It takes vigilance.
Yeah.
You need to monitor your blood sugar levels daily so you know what's going on. You can make adjustments to your medication or your lifestyle if needed. You have to be mindful of what you eat, your portion sizes.
And that's hard.
Yeah.
There's yummy food everywhere.
It's hard. It is. And, this constant monitoring and adjustment, it can be emotionally draining. It really can. It can take a toll.
Okay. So in the podcast, they talk about connecting with other people who have diabetes and
support groups. Yeah. So what advice would you give to someone who was just diagnosed and they're freaking out, they're overwhelmed, they feel alone?
Yeah. First of all, know that you are not alone. There are millions of people living with diabetes. And there is a huge support network out there. Connecting with others, through support groups or online communities, that can really help you feel less alone, less isolated. It can be incredibly empowering to hear from others who are going through the same thing. They understand what you're going through.
Yeah, you're not the only one.
Exactly. You're not alone. And, there are a lot of great resources out there.
Okay, so what are some good, resources?
So you can check out reputable organizations like the American Diabetes Association, the Centers for Disease Control and Prevention. They offer a lot of evidence-based information, tips for healthy living, access to support services.
Okay.
And, there's a lot of information out there. It's important to stick to credible sources.
Yeah.
Especially online.
Yeah, so much stuff online.
So much stuff online.
Yeah. Okay. Now, speaking of all this stuff online, the podcast had this one part that I thought was interesting. It was about intermittent fasting.
Yeah.
And there seems to be some debate about whether it's good or bad.
It's controversial.
Yeah, for people with diabetes. So what are your thoughts on that?
Well, intermittent fasting has become really popular, right? I mean, everyone's talking about it these days. And, it does have some potential benefits. It can help with weight loss. It can improve metabolic health.
Okay.
But for people with diabetes, it's really important to approach intermittent fasting with caution.
Okay.
And to talk to your doctor before trying it.
Why? What are the risks?
So for people who are on insulin or certain diabetes medications, intermittent fasting can actually increase the risk of hypoglycemia.
Okay. And remind me what that is.
Hypoglycemia is when your blood sugar drops too low.
Okay.
And that can be really dangerous.
Okay.
It's all about timing and careful monitoring.
So it's not just everyone should do this. It's it's not for everyone.
Okay.
And it goes back to that individualization of diabetes management. What works for one person might not work for another.
Okay.
And it's really important to work with your healthcare provider.
Got it. Now, the podcast also talked about this thing that I think is really important, the emotional side of diabetes.
Yeah.
And they actually mentioned that like people with diabetes are more likely to experience depression and anxiety.
It's true. It's true. It's a lot to deal with.
Yeah. Why do you think that is?
Well, I mean, receiving a diabetes diagnosis can be tough. It's a life-changing condition. It requires you to constantly manage it. You know there's a risk of serious complications. It can feel overwhelming. It can feel isolating.
Yeah.
And it's important to acknowledge those feelings.
Yeah.
It's not just about the physical symptoms, it's about the emotional impact as well.
So all that stuff that we talked about earlier about managing stress, that's like super important for
It's all connected.
Stress can make your blood sugar levels go up. And that can make your diabetes harder to manage.
So
It's a vicious cycle.
okay, so what are some things that people can do to like manage stress?
Well, there's a lot of different strategies.
Okay.
And the best approach is usually a combination of things.
Yeah.
So mindfulness practices like meditation, deep breathing.
Oh, yeah.
Those are fantastic for calming your nervous system.
Yeah.
Physical activity. That's not just good for your physical health. It's also a great stress reliever.
Okay.
And get enough sleep.
Oh, there's that sleep again.
Sleep is so important. When you're well rested, you can handle stress better.
And you know what helps me de-stress is like talking to someone,
Absolutely.
like a friend or a family member.
Social connection is so important.
Yeah.
Talking to someone you trust, it can help you process your emotions, get support.
Yeah.
Sometimes just knowing that someone cares and is there to listen can make a huge difference.
So we've talked about like a ton of stuff today.
We have.
And before we wrap up, I do want to go back to something that the podcast mentioned. I think it was just briefly, but I thought it was really interesting.
What with that?
The gut microbiome.
Oh, yeah.
Like all the bacteria in our gut.
Yeah.
And how that like plays a role in diabetes.
It's a fascinating area of research.
Yeah, it's like kind of a new thing.
It's relatively new.
Yeah.
But there's some really interesting stuff coming out.
So like what's the connection there?
So your gut microbiome, it's this incredibly complex ecosystem. Trillions of bacteria. And they play a huge role in your digestion, your immunity, your overall health.
Okay.
And emerging research suggests that imbalances in the gut microbiome, also known as dysbiosis, may actually contribute to the development of both type 1 and type 2 diabetes.
So like the bacteria in our gut can actually affect...
It's pretty amazing, isn't it?
Yeah, that's wild.
Yeah. So it seems that certain bacteria, they produce compounds that can interfere with insulin signaling, and then other bacteria, they can promote inflammation. And inflammation is a key driver of insulin resistance.
So it's like all about balance.
It's all about balance.
And if you're out of balance...
Things can go wrong.
Yeah.
Yeah.
So what are they doing about that? Like, is there anything you can do about your gut microbiome?
Well, researchers are looking into ways to manipulate the gut microbiome.
Okay.
Through things like diet and probiotics to potentially prevent or even treat diabetes.
Wow. So like in addition to all this other stuff we've talked about, like taking care of your gut.
Is it another piece of the puzzle?
I'm like suddenly very interested in my gut health.
Me too. It's amazing. It just shows you how interconnected our bodies are.
Okay, well, this has been super eye-opening.
It has.
I feel like I learned a lot about diabetes today.
Good.
But before we wrap up, I want to touch on this one last thing that the podcast has mentioned, and I thought it was super interesting.
Like that.
The power of mindset.
Oh, yes?
So like our thoughts and our beliefs can actually affect our physical health.
It's wild, isn't it?
Yeah.
Yeah.
So what's the connection there?
So there's this whole field called psychoneuroimmunology.
That's a mouthful.
Yeah. It's a big word, but basically it looks at the connections between our thoughts, our emotions, and our immune system.
Okay.
And how they all interact.
So like how do thoughts affect physical health?
So it's all about the mind-body connection. When we experience chronic stress, negative thoughts, feelings of hopelessness, it actually triggers physiological changes in our bodies.
Okay.
These changes can increase inflammation, cause hormonal imbalances, even alter gene expression. And all of those things can contribute to the development and progression of chronic diseases, including diabetes.
So it's like your thoughts are like directly affecting your cells.
Yeah, like on a cellular level.
Exactly. It's amazing. And on the flip side, when we cultivate positive emotions, when we practice gratitude, when we do things that bring us joy, that can actually have a protective effect on our health.
Okay, so it's like...
It's not just what we eat, how we move our bodies, it's also how we think and feel.
Yeah.
It's a holistic approach. Okay. Well, this has been awesome.
It has.
I feel like we really dug deep into diabetes today.
It really did.
And before we totally wrap up, I do want to leave our listener with a final thought.
Okay.
Based on something the podcast mentioned, personalized medicine. So they talked about how maybe in the future, treatments for diabetes will be tailored to each individual person.
It's really interesting.
Yeah, based on their genetics, their lifestyle.
Yeah.
Which sounds awesome.
It does.
But are there ethical considerations with that?
Right. As we move towards this more personalized approach to healthcare, it is really important to think about the ethics.
Yeah.
How do we make sure that everyone has access to these cutting edge treatments? How do we protect patient privacy and prevent genetic discrimination?
Yeah.
These are big questions.
That's a whole other...
Exactly. It's a whole other deep dive.
Yeah. But I think that's a perfect place to end.
It is. It makes you think.
Yeah. So we've been talking about diabetes for a while now, and wow, there's a lot to it.
It's complex.
Yeah, and we're just scratching the surface, right?
Right. Like we were saying with personalized medicine and the gut microbiome, there's still so much more to learn.
Yeah, and those ethical questions we were just talking about.
Exactly. That's something we really need to be thinking about as we move forward.
For sure. But I think for now, let's bring it back to what can our listener do right now?
Totally.
To either prevent diabetes or manage it better.
Okay. So, with all the science and data and research, sometimes it's easy to forget that it really comes down to the choices we make every day. Like what we eat, how much we move, how we deal with stress, all that stuff really adds up.
Yeah. It's all those little things.
It really is. And it's empowering too, right? We have control over our health.
Exactly.
It's not just
Yeah, it's not just fate.
Yeah. Okay, so if you could give 3 top tips.
3 top tips. Yeah, to someone listening who's all right, I'm ready to take charge of my health. What should I do?
Okay, first things first. Food.
Of course.
Eat real food. Fruits, veggies, whole grains, lean proteins, healthy fats.
So basically
ditch the processed stuff, the sugary drinks.
Yeah, all that junk.
Exactly. Just focus on good, nourishing food.
Yes. Okay, got it. What's number 2?
Number 2, move your body. Find something you enjoy doing and aim for at least 30 minutes most days of the week.
It doesn't have to be crazy intense workouts.
No. It could be walking, dancing, swimming, anything that gets you moving.
Okay. So food, movement. What's the third one?
Number 3, and we've talked about this a lot.
Yeah.
Stress management.
Mm-hmm.
Find healthy ways to deal with stress, whether it's meditation, spending time in nature, talking to a friend, whatever works for you.
Because stress messes with your blood sugar, right?
It really does.
Okay. So those are the top 3.
Top 3.
It's interesting how they're all connected.
Totally. Eating well can help you manage stress.
Yeah.
Exercise can improve sleep. It's all linked.
It's it's a web.
Yeah.
Yeah.
Okay, well, this has been awesome. I've learned so much.
Me too. It's been great talking about this.
Huge thanks to our listener for sticking with us through this deep dive on diabetes.
Yes. Thank you for listening.
We hope you feel like you can go out there and make some positive changes.
Absolutely. You've got this.
And remember, knowledge is power.
Keep learning. Keep exploring.
All right, that's it for this deep dive.
Yeah.
We'll catch you next time.